Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video, is missed by
Now,
anybody.
briefly discuss the workup and management of a 25-year-old primate with an isolated soft marker of echogenic bowel in anomaly scan. Okay. So remember one thing, guys, when I'm talking about an echogenic bowel, I mean it's a soft marker, but it isolated alone, not a big deal. But if it's associated with a serious condition, it's one of the markers of certain diseases like Down syndrome, Edwards syndrome, okay, cystic fibrosis. I'll be discussing it in a small while. Just give me 2 minutes, guys. My battery of my phone is yeah. All right, guys. So grade 1 will be the bowel brightness is less than the bone brightness. So we're comparing it with the bone brightness when you're doing the ultrasound. And if grade 2 is almost equivalent, and grade 3, how bright the bowel is looking. It's an echogenic bowel, okay? It's an echogenic bowel. It's a soft marker for certain syndromes. You can't take it light. You just can't take it light, okay? See the fever, when the fever comes, it could be a part of a viral, or it could be a part of a multi-drug resistant, enteric fever, let's say. So fever has to be taken seriously until it's known that it's only because of viral fever. It came for 2 days and it's gone again. But the moment you see that it's associated with a difficult condition, you have to be very serious right from the very beginning. Give the patient time for decision. Give the patient an opportunity for further investigation. Give the patient the gate open for genetic counseling. But it will never be possible if you think in your mind that it's only one isolated finding. You've not even started the journey towards finding out if this bowel, echogenic bowel, is associated with any other syndrome. Correct? So once you get to know the bowel brightness, the second thing is how to associate it. So if it's a normal variant in most of the conditions, it can resolve spontaneously. It's no underlying pathology. 50%. But if it's associated with a chromosomal abnormality like trisomy 21, trisomy 13, 18, it is very much possible that in that case, it's to be taken seriously. It can be associated with cystic fibrosis because meconium ileus, thickened meconium blocking intestine, that is a possibility with cystic fibrosis. Then it's associated with certain congenital infections like torch mostly and parvovirus or some gastrointestinal abnormalities. So for that, you have to refer her to the fetal medicine unit. You might have to go and get a further ultrasound, further genetic tests and genetic counseling, and you require workup to exclude any serious conditions. We should know that it's just one odd isolated finding. Only in that case will you rest. Otherwise, you'll have to go for quad test for ruling out trisomies, torch panel to rule out any congenital infection, cystic fibrosis, you need to do CFTR gene carrier analysis, middle cerebral artery to find out if there's fetal anemia, and obviously for fetal growth and Doppler studies to find out if there is any placental insufficiency causing that. Okay? And for all the conditions, mostly you will require an amniocentesis to find out whether she's having any trisomies and confirm for genetic counseling. Maybe for the infections, you'll have to again, include the maternal medicine unit and consider the treatments. Cystic fibrosis, again, you need to do a genetic counseling. Then growth restriction, you'll have to take out the baby at the time the Dopplers are getting deranged. And for any gastrointestinal abnormality, you have to involve the pediatric surgeon. So these few tables that I have included will make sure that you answer this question very well. Now the indications and accuracy of NIPT. Over here you have NIPT in which you have mostly the indications first. So why will you do an NIPT? Advanced maternal age, maybe an abnormal first trimester screening, maybe a history of pregnancy, previous pregnancy with some aneuploidy, maybe some ultrasound soft markers of structural abnormalities. But remember one thing, guys, it is not a confirmatory diagnostic test. It is not recommended in multiple congenital abnormalities. It is not considered in maternal obesity or in multiple pregnancies, because over here the results are highly unreliable. So the accuracy of NIPT is very high for trisomies, but not so high for any other. And see, for Tau syndrome, it's still 91%. So it's less accurate for rare chromosomal conditions. It could also be false positive because of placental mosaicism. It can even fail in 1 to 5% of the cases. It's a screening test, not a diagnostic test. And a positive NIPT should be confirmed with amniocentesis, guys. All these things should be known to you. It's very good, but it has its limitations. Okay.